Hello everyone. Let's discuss the epidermal nevus syndromes. In epidermal nevus syndromes, there is one component of epidermal nevus and there are other associated anomalies. So let's start our discussion with the first syndrome, Schimmel-Penning syndrome. Here there is triad of extensive sebaceous nevi, neurological abnormalities and ocular defects such as colobomas. Coming to the second disorder, phacomatosis pigmentokeratotica. Here there is speckled lentiginous nevus, also known as nevus spillus, and there is associated hemiatrophy and hemiparesis. Coming to the nevus comedonicus syndrome. Here nevus comedonicus is present just like comedones. Other abnormalities are ocular abnormalities, skeletal abnormalities such as scoliosis, and CNS abnormalities such as corpus callosal agenesis. Coming to the Baker-Nevus syndrome, here Baker-Nevus is present, which is hyperpigmentation associated with hypertrichosis, and these things develop more around puberty. Other anomalies present are soft tissue underdevelopment, for example breast hypoplasia, and skeletal abnormalities such as scoliosis. Coming to Proteus syndrome, here there is cerebriform connective tissue nevi present, cerebriform. Other anomalies such as disproportionate overgrowth of bone, skin, fat and blood vessels. Now coming to the child syndrome. Child syndrome stands for congenital hemidysplasia, ichthyosiform erythroderma and limb defect syndrome. So here is congenital hemidysplasia, ichthyosiform erythroderma and limb defects. Coming to type 2 Cowden syndrome. Here there is linear Cowden nevi associated with breast, uterus and thyroid malignancies. Coming to FGFR3 epidermal nevus syndrome, also known as Garcia-Hafner-Happel syndrome. Here there is extensive nevus present associated with subdural hygroma and cortical thinning. The last disorder is cutaneous skeletal hypophosphatemia syndrome. Here there is nevus sebaceous and hypophosphatemic rickets and other bone dysplasia such as scoliosis. Thank you.